Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. I'd like to acknowledge the traditional custodians of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and emerging. Well, dentistry, it's something that most people have had contact with. In fact, surprisingly, only 50% of people have visited the dentist in the last year, but that's another story. Everyone has had some contact with dentistry in their lives. And today we are going to be talking about innovations in dentistry. And my guest is Dr. David Penn. Now, David and I graduated from Sydney University in 1978. In fact, we used to share a lift into university, and so I knew David very well. And we have very different professional journey. I've been in my practice and absorbed with whatever holistic dentistry and all of that, all very interesting and very stimulating. David's taken a different approach, and he has been an innovator and an educator in the dental profession. Not just in Australia, but globally, as you will hear. He has been the owner of the largest dental laboratory in the world. Now, it's important to realize what we're talking about when we talk about dental laboratories, because dentistry deals with tooth decay and gum disease and a whole range of other issues which every regular listener of my podcast will be aware of. And tooth decay and gum disease are the two most common diseases known in man, woman, or child. And because of tooth decay, there's destruction of tooth structure. So what a dentist does is restore teeth. And sometimes that restoration can be as simple as just placing a small filling. But when a lot of tooth structure is missing, or when a tooth is missing, then prosthetists need to be employed to make these parts of teeth to replace missing tooth structure and missing teeth. Things like crowns, things like dentures, things like implants. So that is what a dental lab does, and they are an integral part of any dental practice. They are the back end of what supports the dentist's ability to restore people's teeth. And so David's dental laboratory really did achieve some great heights, but he's been at the forefront of so many dental innovations, and as you will hear, some remarkable innovations coming our way. Anyway, I hope you enjoy this conversation I had with Dr. David Penn. Welcome to the show, David.
Hi, Ron. How are you?
I'm very well. David, you and I, it's hard to believe, but you and I graduated from dentistry together probably almost 45 years ago, 44 years ago.
Yeah.
And, we are on professional journeys. You've been on an extraordinary professional journey while you've been in private practice. I wondered if you might just share with us some of the things that you've been doing in that time.
Thanks, Ron. Yeah, it's hard to believe that the end of 1978, even when I say that, I just sort of shake my head. But yeah, that was when we both graduated. We had, a lot of fun in dental school. We worked hard. But I think actually in reflection that we were very fortunate that we were at a very good dental school and we got an excellent education. And, in relation to sort of what I've seen globally, and I've really, taught all over the world now. I think that we were very, very, very fortunate that the cost wasn't prohibitive for us. We weren't anchored down by some, incredible sort of payments that we had were ongoing, in which I see, the younger generation sort of has experienced headwinds from. And I think that the world was our oyster. I think, much as it might sound funny, the number of decayed, missing and filled teeth ratio back then was fairly significant. So there was plenty of work to be done. I don't think there was an oversupply of dentists. There certainly wasn't an oversupply of dental schools, and we could talk about that. I want to talk about in Australia. And so there was great opportunity. If you went down one path, I went into practice immediately, unwittingly, blindly, stupidly, whichever sort of term you'd like to use. I went into private practice immediately, and I went into private practice up in King's Cross in Sydney, which, looking back on that, was sort of like really asinine, but it was a great opportunity in a way because it threw me in head first. It made me really develop my skills quickly. I went to the States early on, and I was very lucky that I spent quite a bit of time with Gordon Christensen. and he was a very big influence on me in terms of looking at things and trying to develop things sort of in terms of excellence. In really, like he had his clinical research associates in Provo, Utah, and I went there and I ended up working with him a lot. Sort of when we built Southern Cross, he was a big influence as well. So looking back on it, I sort of think that I was placed in an environment which I had to swim very fast because I had nobody around me. I had little experience. The dentist next door to me helped me sort of quite a bit, which was great. Harry Rich, a lovely guy. I don't know if you ever met him.
I do remember him.
Yeah, a lovely guy, and he helped me a lot. I think one of the things that was really interesting for me early on was two things. I think one is that in the King's Cross, we had a demographic which was almost from the sublime to the ridiculous, where we were getting a lot of wealthy people from Elizabeth Bay, and then would get right down to the hobos on the street. And that sort of let me sort of see, again, 1,000 shades of grey, how to treat complex cases, how to relieve pain and everything in between, and how to deal with all walks of life. And that, I think, was in itself was a great experience, rather than just going into a bubble, perhaps in the eastern suburbs or the city or anywhere, and perhaps in Australia where you're sort of dealing with one cohort. I had to deal with all different sort of sorts. That was really, really sort of significant. I think the other thing, from my perspective, was that because this Harry Rich was next door to me, he was a Canadian graduate, and he'd done a master's in Canada. He was actually intertwined with some of the major supply companies in the US. And I remember when I was a kid, I was 23 or 24, he would show me these catalogs from Henry Schein and Darby. They were the two biggest supply companies. And I was absolutely fascinated with these things that somehow or other, the range of products and the sort of the innovation that was even within these catalogs just fascinated me. And I would pore over these things. I'd buy stuff from there. And I thought, this is interesting that a mail order business could be successful in dentistry. And I was fascinated. I mean, I was enjoying the clinical side, but probably at 25, 26, I remember saying to my wife, after I got married, I said, this is going to kill me. I can't do the same thing for the rest of my life. So when I was looking at these mail order things, these booklets, and they were thick, they were like almost like small telephone books. They were very impressive. I actually went and studied all about mail order businesses. And I remember having these big, thick textbooks, and I read and I read and I read, and I thought, well, this is something that I think that I can do. The only question is I needed a product. And, we had a good education, and I thought, well, what is there to do? And I looked at the business side of things, and I think that led me down the path of thinking, well, dental laboratory fees, as you remember, were particularly high back in those days, and are ridiculously high. I remember even back in 1980 that there was a guy on Macquarie Street, an Italian guy, I won't mention his name, but he was charging $250 for a porcelain fused to gold crown from a laboratory perspective, and we were charging like $600-700 for a crown. And I thought, this is asinine. This cost is prohibitive. The quality was good, don't get me wrong, but it was slow. The guy was difficult to deal with. The results were good, but I thought there's got to be an opportunity here for somebody if we could make a value for money proposition. And of course, that's where the concept of Southern Cross sort of started. And I thought, well, I've got to find a quality manufacturer. I've got to find somebody who can do it at a value for money proposition. And I've got to set up a logistics chain that's going to work and work consistently. Now, when you look at all those three things, it's almost like that's a unicorn. It doesn't exist. And I think
this is all at 25, David.
Yeah.
25, 26.
Yeah, I was. I was only a kid. And I remember thinking to myself, gee, look, so I flew to Hong Kong because I thought, well, Hong Kong's close by. Cathay Pacific have got, good sort of consistent routes, 8 hours, 45 minutes there and back. So there in one direction. And then I thought, well, I wonder if I can go up there and find a laboratory or find somebody who could produce some crowns, all those things that I was looking for. Lo and behold, I went up there and I made a plethora. I made a bunch of mistakes like you wouldn't believe. We backed the wrong laboratory. We used an agent. There was just everything that could have gone wrong went wrong. But nevertheless, the interesting thing is I sent out a mailer because I'd been reading about this mail order sort of concept to every dentist in Australia. It was September 1983. Now, China, if you put it in perspective,
Right.
China had just opened up, Ron. It was remarkable. I went there. There were. I'm not talking about Hong Kong. I'm talking about crossing into mainland China. Rice paddies. Shenzhen, which has now got 15 million people, had 50,000 people living in a shanty town. There were sandhills. It was so backward. It was incredible. And there were guns, and there was machine guns, and there were tanks. And they took my passport, and I went to a hospital that had no glass and the windows. It was incredible. But what an experience for a young guy. But I soon realized that the Chinese, and regardless of how critical you are about their sort of perhaps their political regime at the moment, are remarkable people in terms of their work ethic and their ability to be able to reverse engineer and produce goods of quality is phenomenal. And I saw that and I thought, wow, if we can harness this, we've got something which is really, really, really special. So I think the thing that sort of confounded me and where I probably made my first error is we were making crowns of a reasonable quality for $11, right?
Wow.
Now, if you could make them for $11 and the guy in Macquarie Street was charging $250, that gave us quite a bit of scope in between to sort of try and sort of say, well, look, I can make a margin here. And if I can get this whole game together, we got a proposition. So cut a long story very short. We sort of developed that, and I spent a lot of time in the next probably 15 years developing this. It took a long time to get it right. I hooked up with the University of Hong Kong, which is a remarkable academic institution because the great thing about Hong Kong in particular is that the universities are highly revered, and when people pass on, they leave a lot of their life savings to the universities. And so University of Hong Kong was a very wealthy organization with the best technology imaginable and a really, really, really good school. And I organized something with them. I met some nice people there, and then we formed this laboratory that went on to become one of the biggest in the world. And it was a great journey. I think there was one story which I think is interesting, Ron, and I think for a lot of younger dentists who may be listening to this or watching this, it was interesting talking about innovation. So, I mean, making a crown hasn't really changed much in terms, certainly in the manual process. You know, pouring up a model, trimming the model, making a coping, adding some ceramic, firing it, making it pretty. And the rest is pretty sort of straightforward. But one of the big problems we faced was that we were getting an intervention from in China, in that the internet was being watched and any emails, and we did notice that we were losing information on a consistent basis. So Ron Ehrlich would send me a crown and say, so David, I want shade A2. And we would have an order form, we'd send it to the lab, everything would go nicely. But in the meantime, Ron had decided, hang on, A2 is not what the patient wants. Patients come back and said, I want a cross between A1 and B1, which is lighter. So then I sent an email to the lab and say, look, that case number 1, 2, 3, 4, 5, we're going to change it from that color to another color. Now, the problem was then the crown would come back, but it would come back with the initial color that Ron had asked for. And the email had not arrived because of the fact that the internet was being scoured and being watched carefully and edited by the government. And so we were losing information all the time. So we had to come up with a system that could manage an incredible amount of data and also circumvent the email process. So I came up with this a tracking system, which I probably think was about maybe 10 years ahead of its time, whereby it was almost like an online spreadsheet, but it was color coordinated. So if Ron made a change, I would change the color from green to red so that there's a problem, and then there would be a notation about what that was. So all of a sudden the lab could see, and we're dealing there then with hundreds of, if not thousands of cases a day, they could see a whole bunch of red marks all over the place. They knew that needed attention. And that single-handedly, that online tracking system, which I wrote manually, and then I gave it to a developer. This is in 2003, so it's almost 20 years ago, and it's still working. That single-handedly gave us the ability to be able to look after massive amounts of data in relation to dental cases, and without any sort of fear or trepidation that data was going to be interrupted by any government intervention. So that in
So,
itself.
David, you were collaborating with Hong Kong University, but the laboratory was on mainland China.
No, the laboratory was in Shenzhen, which is the special economic region just next to Hong Kong.
Oh,
But the
okay.
thing is, we got the staff from Hong Kong University. The thing is, they were trained. They had the great school, a technical school there, and a guy called Godfrey Nye, who was a very brilliant man and a great educator. Um, he took the guys out of the university and we put them into the private enterprise, and I think we ended up with about 3,000 technicians at one stage.
Extraordinary.
And we built premises, or Godfrey built premises, where we could actually house 1,000 of them.
Wow. As
And
in live.
yeah, it was a small town. It had restaurants, it had a theater, it had a basketball court, it had all sorts of stuff. So in itself, it was like people were coming from all over China. They'd get trained, they'd be given accommodation, and 90% of them were females. Remarkable people. Ron, I can't give high enough praise to the quality of the people.
Well, David, you kind of are not the only one that has moved major and highly technical manufacturing into China. I mean, you were ahead of the game in the dental world, but every electronic device we have in my room here now, I put money on the fact that it was made in China.
No doubt, Ron, and a lot of the other devices which we might talk about this morning, we all have now. I have a bunch of Chinese manufacturers who in everything that we do, from all the acceleration devices to TMD devices to almost everything that we've got that we're producing now is being made in China. But the interesting thing is, Ron, is that we're going back to 1983. Now, it
Yes,
was like made in
yes,
China was almost like, and that was one of the big hurdles we had to overcome, because back then it was made in China. It was earmarked as rubbish and going to fall apart. But like with Japan, post-war Japan, the same thing happened. The attitude changed
yeah.
until, of course, you've got the most incredible manufacturers now in Japan and China in Shenzhen now. Ron, it's just, and I spent a lot of time there as well. Or yes, I did before, up in the last couple of years where it's been COVID and it's been more difficult politically. But I've spent time in the warehouses and the factories, and yeah, it's incredible. It really is incredible. The only thing I can sort of say, just in relation to that, is generally speaking, innovation is not their strength. Reverse engineering is definitely the strength. So, Ron, it would need a Ron Ehrlich or a David Penn to go there and say, listen, I need to make this, and this is how I want it, and I'm going to give you basically the blueprint of how to do it. Now, if we do that,
Yeah.
they take it like a duck to water. But if you sort of say to them, I want you to invent that, there's trouble. They're not.
But it's funny, isn't it? It's funny that people feel somehow surprised that they will then reverse engineer and start. Well, people might call it stealing technology, but they've been used to making it for so long. They think, well, we may as well make it ourselves.
Absolutely, and then invariably they'll make it better and cheaper, and they'll get the production lines more efficient. So yeah, very, very, very clever. But as I said, the only thing lacking, I sort of say from time to time, is pure innovation, and it's almost like
Yeah.
if somebody said to me, "What is the essence of innovation, sort of globally now?" I would sort of, and to commercialize, I would sort of say the sort of creative thinking needs to happen almost in a Western democracy, and then the process is taken to a line of production which is cost effective and where the quality is high, and take it into China, and then you go back and market again in the Western democracies. So I found that model, and I've done this all over the world. I'm not saying we get it right every time, but generally speaking, I'd sort of say if you can do that, you're on a winner, especially if you've got something which is particularly innovative. And Shenzhen now, Ron,
Yeah.
if you went to Shenzhen now, and I think a lot of the Americans in particular, they've got no idea. I mean, they're so xenophobic, as you know, but
Yeah.
if I put you on a plane, I said, Ron, we're going to go to Shenzhen now, and you think, well, what am I going to expect? It's like Gotham City. It's like it's not something where you're going to see a paddy rices, paddy fields and rice fields. You see this incredibly high tech environment. It's just like it's more high tech everywhere you go, and they're talking about it. And the kids have got computers, and it's just like it's part of their ethos now. It's phenomenal. So if people sort of underestimate what's happening in China, it's understandable because they haven't been there. But if you go there and you interact with the people, you realize they're phenomenal people, hardworking, very clever, highly organized, and there's no stopping them, in my opinion. And I spend time in the States as well, and the Americans have just got no idea what's going on. So
Yes. Well, are you filled with, we're kind of, the press fill us with fear. Oh, China is going to take over the world. I mean, does that scare you?
no, no, it doesn't. Look, there are obviously some political parts, and don't get me wrong, I'm not a fan of particularly that their politics completely, but there's a lot of positives there, Ron, and it doesn't sort of scare me at all. I mean, you can look at the other end of the political spectrum, and without mentioning any names, that frightens me probably even more, because that's that. Well, look, I won't go into politics, but I just think we have to
No,
be.
no, no, it's
I
all
think we
good.
have to be very respectful of the fact that the Chinese,
Yeah.
in Australia in particular, if we take away Chinese manufacturing, if you look around your room and look at the tech and you look what's in
Mm.
your house, etc., and you take away Chinese manufacturing, Ron, particularly in Australia where our manufacturing sector has been decimated, high
Yeah.
wages, obviously, and the rents, the real estate prices are ridiculous. And one of our family businesses is Lowe's Menswear, and we
Yeah.
sort of we're highly reliant on the brilliant expertise of the Chinese again, and that's for every working man in Australia, can relate to that particular product. Now take that away, and what happens? This fleece that we sell for $24.99 all of a sudden is $49.99. If you make it in Australia, it's $69.99. Now that
Yeah.
makes a big difference. So we are so
Yeah.
reliant upon the Chinese now. Um, it's going to be interesting for our grandkids, Ron, how they're going to be coping with this because there's a lot of grey clouds wandering around at the moment, or dark clouds.
Mm.
But
Yeah.
I just think my experience with China is, yeah, there might be some criticisms of their political process, but go down to grassroots
Yeah.
level, and they're just remarkable, remarkable people.
Yeah, yeah. Well, I think we won't go too deeply into it, but I think history tells us a story of who we really should be fearful of, and I'm not sure it's China that we should be that scared about. But let's not digress too far
Sure,
into world politics, because I think we're both on the same page there. Let's come back to innovations in
sure,
dentistry,
sure.
a much lighter topic, because your laboratory, as you mentioned just, and people may have missed it, but I didn't, and that was you built what was literally the biggest dental laboratory in the world,
Yeah, well,
which is a remarkable, remarkable
I
achievement.
was part of a process. Very lucky again that I was that we sort of this relationship I had with this Chinese guy called Godfrey Nye, and a couple of his partners. Um, we set it up almost inadvertently in a way that we basically said, well, you worry about the product, and I'll worry about the marketing and the education, and also and the innovation, saying, look, this is where we're heading. This is the value for money proposition we want, and back it up by education. I think that was the one thing that I was determined to sort of say, look, if we are going to do this, this isn't a technician. If a technician rings Ron Ehrlich and says, listen, buddy, your margins are rubbish, you'll say, well, I'm a dentist and you're a technician. What would you know? That's generally the attitude around the world. On the other hand, if a
Yeah,
dentist rings Ron and I say, Ron, I've got an image here of the impression you took, and we pour the model up, and if you can tell me where those margins are, you're a better man than me. You mark out of yourself where those margins are. Now, most of the time, Ron, there was maybe sort of like a little bit of a grumble.
now, David, let me stop just there for the listener who may not be familiar with exactly what you're talking about. When you say margins, you are actually talking about how accurately a crown fits onto a patient's tooth.
Absolutely,
Go on,
absolutely,
continue.
absolutely. So what we're talking about is, yeah, how actually did you record what was in the mouth and reflect it sort of in this piece of silicon that you've sent to us? Because if we're going to make a prosthesis for this patient, we want it to be really, really good, and we don't want there to be any problems whatsoever. So again, coming back to our education, Ron, our standards were high. We were taught well at university, and we had high set of standards, which again, wrongly or rightly, but I actually thought that every dentist in the world was like that. But I was a fool in that, and there was many people said, "Oh, David, don't worry, just do the best you can." So there were plenty of dentists around who would actually, we would have a nickname or have an acronym on. It was called DBP, do best possible, which means that they had absolved themselves of any responsibility, and they said just almost like guess where the margins were. But Ron, that changed the whole game, because all of a sudden, if I had an image and I knew what I was talking about, and I said, Ron, you didn't use a retraction cord, you didn't define the margin properly, it's uphill, down, blah 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 blah. You're going to have an overhang, you're going to have this, you're going to have that. The metal coating is going to be too thin, it's going to flex, the ceramic's going to break off, and you're going to blame me. No, buddy, it doesn't work like that. If you're going to work with us, this is what we need. So I was, and that caused some consternation. And some people told me to get nicked and da da da. But a lot of people realised that we were serious and that we did have something which was evidence based. And the fact that with the internet coming on, that we could actually move data backwards and forwards, so imagery, I could send you. I'll say, Ron, I'm going to actually email you a picture of the margin to da da da. Now there's no hiding, and you know that, and I know that there's no hiding. Like, where does this actually join? So again, using technology again, that was monstrous, and then using education as a sort of as a selling tool. And I went around a lot, as you know, I went around a lot. I spent a lot of time sort of teaching people about margins, about this and about that. And I think in innovation these days, one of the it's very hard to hang your hat on price. If you go to look at Michael Porter's ideas at Harvard, the two different ways about looking at competitive advantage. You can have a niche product which is going to be highly innovative, which is different, or you can compete on price. Now, rarely do you get that combination where you get something which is niche and high quality, but incredibly credible value for money. Now, we happened to hit upon that unicorn, Ron, because we had an incredibly high quality product and we had incredibly low prices. So all of a sudden we'd hit something which was, don't get me wrong, it might all sound very easy to set this up. It took a long time to get it right. But when we did, we knew we had something which was almost unassailable. And my mother actually said to me, and you met my mother said to me, she said, Dov, you're going to kill the technician industry in a lot of places. And I said, well, maybe not kill it. I said, but maybe I can, we can manicure it so that the best ones sort of survive. But there's no doubt about it that the model that we had, we created something was almost impossible to compete with. And I would say even a lot of the things I've done even since then, the Dentroid one is an interesting one, which is, I'm not saying somebody else can't do it, but that's something which is going to be a paradigm shift in dentistry as well. But from an innovation perspective, to get all those pieces of the puzzle right, it made it virtual.
Now, listen. Let's just fast forward a little bit here, because you've set the stage there for other innovations which have occurred, and I know that when you and I graduated, one of the biggest innovations in the mid-'80s was the decision to wear gloves and masks when we were treating patients. Yes, it's almost unbelievable, but that's how far back we go. Where when we graduated, that was an option.
Yep, absolutely.
But then if someone had said to us 30 or 40 years ago, you're going to be working with computers and I know in my practice I use CAD/CAM, computer-aided design, and computer-aided milling in my practice. Tell us a little bit about some of the innovations that have occurred in this time.
Look, there's some really fascinating sort of stuff. I think one of the first things that I remember was probably one of the most significant things of the lot was there was a professor at Hong Kong University who said to me that he knows a way that we can bond ceramic to tooth structure. Now, we had been doing acid etch stuff sort of, even when we started, I remember, Ron, we actually had part A, part B, self-mixing composites. Like you had about 30 seconds, mix it, get into the thing as quickly as you can, and it's self-curing. And oh my God, it was like how many times you get it halfway there and it's set. Temperature sensitive, technique sensitive, just crazy sort of stuff. So obviously, when the ability to acid etch enamel was a big one, but then the ability to add hydrofluoric acid to certain types of ceramic and being able to bond a ceramic to tooth structure. And initially it was only enamel and then it went to dentine. But even the first time that I was in Hong Kong, this would have been about 1988. And I remember he said to me, look, David, come and have a look at this. And he looked under a microscope and I could see all the micro etches in the ceramic. And he said, well, if we can get a resin in there and we can bond it on there, we can actually put a piece of porcelain on the front of somebody's teeth. And that was really the birth of porcelain veneers. Now, that was a major, major shift. And I thought, oh my God, this is going to circumvent the plastic veneers we've been doing, which, don't get me wrong, were very good. And that was a really, really major innovation. So, I mean, that was really sort of something. Then I remember I was involved in the milling of zirconia, which was great because this was obviously a material that was reasonably aesthetic, but it had physical characteristics which absolutely outstanding. It was a difficult material to work with. And then the ability to be able to bond conventional porcelain to zirconia, I was sort of involved with that as well. And that was another breakthrough because
zirconia is a really hard material. I mean, I've heard it described as white steel.
Yes, absolutely, right. And the big problem was, and even today, is a lot of people don't understand that they put these full zirconia crowns on people's posterior teeth, and patients come back 5 years later and that zirconia is sitting there pristine like nothing had happened. But look at the opposing tooth and it looks like it's done sort of 20 rounds with Muhammad Ali. It's sort of like it's just beaten to a pulp because it's just worn down. I'm really showing my age when I talk about Muhammad Ali. But yeah, I mean, people don't. And look, I don't know about, the material sort of science, how much that's being taught. I'm sure in dental school it is being taught to a certain extent, but I don't think really people really understand the ramifications of putting something that rock hard into somebody's dentition. You need like versus like, or a little bit softer. So zirconia was great, but the only problem with zirconia, it's not aesthetic, very opaque, very hard, and very, very difficult to sort of to match. The fluorescence and translucency of human enamel. So that was but certainly in a lot of respects, the fact that we could CAD cam them, and as you'll be milling stuff sort of chair side, that really in itself was quite remarkable. Scanners were another thing. First of all, we had lab scanners. All of a sudden, we could start to, and this came in probably about 15 years ago, where we could scan impressions. And that sort of really sort of quite accurately down to about 27 to 35 microns accuracy, which was sort of a big advantage. And then, of course, the scanners came in the mouth, the intraoral scanners. And that was another thing which I was very involved. It was a lot of this came out of Israel, out of the the defense forces, the tech there, and that made a monstrous difference because all the sort of the onerous issues with using impression material, accuracy, shrinkage of vinyl polysiloxane, and a lot of inaccuracies there. That sort of has been
because putting all these different materials into people's mouths to take impressions for various devices was fraught with lots of variables that was, so how did you mix it? What was the temperature of the room? Did you pull it out too early? Did it make the patient gag? Did it do this? Did it do that? And here we had a camera that you just put in the mouth and went click and you got an image.
Yeah, well,
amazing.
But even then, that was even back, I think in K-Dent, the first time I saw them out of Israel, and we bought 10 of them. This is in about 2009. They looked like small machine guns. They weighed about 10 kilos. You needed to be Arnold Schwarzenegger to be able to manipulate the thing. The heads were big. They were slow. That accuracy was probably about 50 to 60 microns. which is really, you really want to get down probably sub 30 microns as far as, with a luting agent.
Now, a micron for our listener is a thousandth of a
Yeah.
millimeter. What about the CEREC system out of Switzerland?
Yeah, well, Ceric was okay, but again, there was a red one, there was a blue one, there was all these different versions of them, and as times got by, they're getting better and better and better. But again, there's if you and I wrote a few articles about this. In that, are they as accurate as you think they are? And we could talk for hours about this, but nevertheless, regardless of that, there was similar accuracy to an average impression. But from a comfort perspective, from the patient's point of view, it's much better somebody else puts a little clicking camera in there and takes a video of this tooth rather than sitting, with half a kilogram of putty in your mouth, which ended up down the patient's throat, and all the dramas of that, which was uncomfortable. So I think, Ron, in particular, that was a tech that has been remarkable, and it's only going to get better and better. And we'll talk about Dentroid sort of in the robots and the lasers in a moment. But there was so many things. I think, Ron, the other thing, this is one innovation which I really would like to talk about. If we wind back the clock to 1999, now the .com boom was on in the States, and people were throwing money left, right, and center at tech. There was plenty of venture capital around, and a guy called Zia Chishti. I don't know if you've ever heard of Zia. He was, and his girlfriend, they were the guys who started Invisalign. And Zia was a very, 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 very clever fellow. I've spent a bit of time with him, and they realized that back in 1947, inadvertently again, that a guy called Kesling had noticed that an overextended denture leaning on a molar, all of a sudden, if he overextended the denture and it hit on that prematurely, all of a sudden that tooth moved. And then he realized if he added a millimeter or more of acrylic on that tooth and lent it up against that tooth more, is going to continue to move. And now he realized there was a relationship between how much he added, how much time there was, and where the tooth would end up. And he thought, well, hang on, if you could look at all these sort of variables in that equation, you're going to come up with something which is somewhat predictable. So they all of a sudden now, when you stop and think about it, it was pure serendipity. But nevertheless, this is how it sort of started. So these young guys said, hang on a minute here, we believe that if we put some plastic in people's teeth and we push it against the premolar is going to move towards the outside. The arch is going to be bigger. We're going to make some space. And all of a sudden I can put those front teeth back in because I've got more space. And, well, you can see where it's gone. Now it's, a line tech is a 60.
Well, but David, hang on. Give us, because I know what you're talking about, and this is the birth of a revolutionary way of aligning teeth. Give us Invisalign 101 to someone that wouldn't have a clue what you're talking about.
Okay, well, basically, right, in a nutshell, you've got a clear piece of plastic which has a shape in it, which when it's put into somebody's mouth, it pushes teeth in a certain direction, certain teeth in a certain direction in a chronological sequence, in a timely sequence, to sort of say, it's like a game of chess. I'm going to move the pieces at the certain times in a certain direction, and I'm going to try and then move them into a pattern which is aesthetic, which is going to be functional, and do it in a way where it's not fixed in somebody's mouth. It means you wear this piece of plastic 22 hours a day, and 90% of the time it's going to move really where you want them if you're fully compliant. Now, to get a patient to be fully compliant, a lot of people don't realize that, if you don't have them in the mouth all that time, it's not going to be completely successful. But that fundamentals are pieces of plastic can move your teeth quite predictably, especially if it's sort of that treatment plan is done well. So this is a remarkable innovation in relation to the fixed braces, which had been around for more than 100 years. Orthodontics had started in the beginning of the 20th century, and remarkable process. And I'm still heavily involved with Align Tech. A lot of the innovation processes that I'm involved with today surrounding making that whole process even more predictable and faster and more streamlined. We've developed a number of things, and I've got two or three more products that are about to hit the market, one globally with Align Tech. And it's
Hmm.
fantastic. So the kids of today don't have to, the fear of having to wear braces, for a long period of time. I'm saying there are some people who do need braces, of course, but for different reasons, more complex cases.
Mm.
But from an aesthetic point of view, and mostly for some reasonably complex functional perspectives, these clear pieces of plastic really work very, very well. So, what a phenomenal innovation!
Yeah, and I mean, we in terms of age in our practice, our youngest, because of compliance, is probably around
Yeah.
15, and our oldest is 82.
Wow, wow, that's fantastic. Well, I think that's incredible, and I actually had somebody this week who, again, a guy late 70s, was a former Qantas pilot, very techie sort of guy. He said, "I want you to move my teeth." I said, "Are you sure?"
Yep.
And again, it's so, I mean, the fact that we can do that, it's just phenomenal. So I would say, Ron, that was in itself one of the most incredible innovations that I've seen. And
Mm.
it's heading. I'm not saying it's flatlined, but let's sort of say the rate of innovation in that area has slowed down. Obviously, because I'm not saying it's perfect, but it's getting better and better and better. And there are a lot of copycats, a
Yep.
lot of direct to consumer models around where some patients think they can just order stuff online. It's got to be done properly, and I think that's very important for any of your
Mm.
listeners who may be considering stuff like this. It's got to be done through a dentist, and don't just sort of look up one of these do-it-yourself kits because it's going to be disastrous. So it's got to be
Yep.
done properly.
Now, another thing that I know you're working on is this Dentroid system, which is tell us about Dentroid.
Okay, Ron, that's interesting. So the that I use have a team of industrial designers, and we work very closely. My daughter has got a double degree in manufacturing and mechanical engineering, and also in material science. So she and that was at New South Wales University. So we needed, in a lot of the stuff we're doing, we need great engineering, we need understand material science, but we also need industrial designers. Now, this team of industrial designers were approached by two guys who came along and said, "We got this idea about building a little robot," and we actually applied for a patent of miniaturizing a turbine, and the original idea was a miniature turbine and putting it into patients' mouths and being able to control it almost like a PlayStation type sort of scenario, Xbox, whatever you want to call it, where you're using a joystick, etc., where you can actually look at a computer screen because it's got cameras inside this little device, and where we can decide which teeth, how much tooth structure we're going to remove, and do it, in a controlled environment. So they came to me and they said, "Would you like to get involved? Because we know that you guys have been doing a lot of this stuff." And I looked at it and I went to General Electric because I thought, well, if we're going to do it, let's do it properly. And I like to do it. I don't like to sort of really half do things. So we had a lot of discussions with General Electric, and we built some interesting ideas. And after a period of about maybe 6 months of looking at this, I said to the guys, from our perspective, it's impossible. We can't get anything which is going to generate enough torque in this particular size with this size dimensions and be able to. And I wasn't going for a class one for just a small cavity preparation. I was going for the nuts. I was going for basically a crown preparation. I said, if we can actually start off and do a crown preparation with this thing, then we've really sort of circumvented the minefield. Anyway, so we aborted that, and I remember actually I'm sitting here in my house in Point Piper at the moment. I remember bring the guys in. I said, "Guys, I think we've got to give up the idea about the turbine. How about we bring lasers in?" And they looked at me, they were shocked, and they said, "Oh, gee, I said, because in my opinion, a laser is something that we're going to be able to control a lot better. And I think that the possibilities, and there's a lot of work being done on this, and I think that to me could be the future of where this miniaturized robotic sort of type of device." So we actually got one of my guys to draw up a very futuristic and if you like, I can share this with you. One day, this picture of basically looked like something in the space age, a young dentist sitting there with a joystick, patient in the mouth. The patient's got this sort of like virtual sort of reality thing on to take them away. It's got the robot in there, and basically the dentist is controlling what's happening in the mouth. That was a very futuristic thing that we drew up. Now, to this day, even in the pitch that we're using today, we still use that diagram. That was really where the concept sort of started. So, Ron, the whole idea here was that we wanted to be able to see if we could affix something to a patient's teeth, surrounding teeth. And we got one that we needed, I know needs some work. And the idea here was to incorporate a laser, if at all possible, that could ablate or could actually remove enamel and the underlying structure, the dentine as well, in a manner without anesthetic, without cooling, without an irrigation. So we're not having air, we're not having water, and we're not sort of heating up the tooth. So it's going to absolutely fry the nerve inside there, and without any vibration, which was rapid, which was incredibly accurate, down to I think about 7 microns. Right. And this is not sci-fi. This is happening. This is real. We're doing it already. And then to be able to do it, the idea then was to find a sort of a laser source. And to get the right people to be able to do this, that was extremely difficult because there was a lot of so-called laser experts and there were a lot of old-fashioned, all different types of lasers, as I'm sure you're aware of. And so it took a long time. Now, I was the chairman of the company for a while, but I simply didn't have the time because I've been involved. A lot of my area of expertise was in oral medicine products and also in orthodontic stuff. That's where I'd been really concentrating. But I invested heavily in this company. I'm one of the major shareholders and I'm sort of an advisor to the company. So I removed myself being its chairman because I just didn't have the time. And we brought in a bunch of experts who really knew what they were doing. Now, this took a long time to put the team together. But now the team that's there, including Laurie Walsh from the University of Queensland, Hiko Spalak, the Dean of Sydney. I mean, we've got a world-class team now working on this thing, and it's happening. So a lot of the work is being done at ANU, which again doesn't have a dental school, but nevertheless a school of physics. And I've been down there and I've seen the teeth being ablated. And Ron, it's like the accuracy of this thing, and not melting tissue. We're just it's ablation. It's mind blowing. Now, the thing for your listeners in particular to let's take it to the next level. So we've got the ability to be able to remove tooth structure, both enamel and dentine, in a very, very biologically sound environment. Now, if you take that one step further, and this is where it gets really, really interesting, is that if you've got a small little box, tiny little device that goes on top of the tooth, and the first thing that goes in there is the possibility is that it's got cameras in there that can scan that tooth. Now, if they scan the tooth and it says, Ron, you know what? We need to put a crown on this tooth. So what are the ideal dimensions? You're taking the human out of this. Ideal dimensions for a crown prep that we want to do to be able to fashion the tooth, to be able to a crown to be up. And we know that we want to reduce the top part by maybe 1.5 to 2 millimeters. We want to reduce the sides by 1 to 1.25 millimeters. We'd like to put these little margins like this bicycle track around the bottom of about 1.25 millimeters. We want to do that at certain angles and this and that, the data. We want it to finish at a certain spot. This particular device has the ability to be able to do that, to plan exactly what that is going to be. So it's almost like textbook. You're going to get something that no human can actually produce, or they can, but they're very, very hard. Now, then of course your mind is going to, well, hang on a minute here. If I got the ability to be able to cut that tooth down on the side table here, I've got my milling machine. I've got a piece of zirconia or lithium disilicate, which is another type of porcelain. Now, whilst the tooth's being cut down, I'm starting off with a block of this other ceramic, and the milling machine is cutting the crown as the tooth's being cut simultaneously. So you're getting the prosthesis is being made whilst the crown the tooth is being removed. So 15 minutes later, all of a sudden it's like, Ron, here's the crown and there's the tooth, and all I got to do is put a bit of glue inside that crown and go bang on there, and it's game over. Now, when you stop and think about that in relation to where you and I were back in 1977, 1978, back in those clinics, and we were doing what we thought was state of the art stuff. And well, somebody would have said, Ron, that's what we're going to, what's we're going to have, and we can envisage that. We would have just slapped each other and said, look, you know, what are you smoking? What are you drinking? Because we just couldn't even envisage that. But this is where it's heading. So this is a reality. So, you know, it might take, by the time this is fully commercialized, it might take, you know, 3-4 years to really, you know, to get there, maybe even longer. But I can promise you this is going to happen because we've got the ability to be able to ablate, to cut the tooth extremely accurately, to scan. I mean, to be able to scan a tooth now is no big drama. We don't need water. We don't need air. Yeah. So, I mean, I think that in terms of
I remember.
wow.
Well, I remember attending a lecture you gave a few years ago. It was probably about 4 or 5 years ago, and you said to me we were working on a small robot that will fit over the top of a tooth and do what a dentist does. And now you're describing even more so. I just kind of, I went back to my practice. I told everybody, and we kind of just shook our heads, not doubting you, I have to say, just wondering at this incredible innovation. Now, something else I know you're working on, which is an app, and we just touched on it before we started our discussion. Share with us Open Wide Dentist.
Yeah, look, this is one we're very, very excited about, and we're just scratching the surface really about this one. This was so back in the 80s when I went to the States, you know, not long after I graduated, and I spent some time with Gordon Christensen. And I remember Gordon showing to me, he said to me, look, the ability to be able to see in people's mouths and, you know, to be able to capture imagery and all sorts of things it was quite challenging back then. And he showed me this sort of device, which was a series of mirrors at all sorts of angles, and it had a battery in it, it had a light in it, had a little bit of a air fan in it. And I looked at this thing and I thought, well, that's interesting. And then but you need an SLR camera to be able to then look at the reflective surface of what you're aiming for. The light wasn't particularly good. The fan wasn't particularly efficient. There was a lot of things wrong with it. And I looked at this thing, I thought, gee, yeah, that's it. And I remember it piqued my interest, and I just put this idea away for a while. Then about, God, maybe 13 years ago, about 2010, probably about 11, 12 years ago now, I was in Germany and I saw an upgraded version of this thing. And the fan was better. The lights were better. It was still battery operated. It was clunky, but it was really effective. And I was involved in teaching Invisalign. I thought, wow, this is a great way to start taking intraoral imagery using a reflective surface again. But that was with a digital SLR camera. I thought, okay, that's good. It was incredibly expensive though, Ron. I remember even back then it was like 400 euros. And I thought, no, this is okay. I ended up buying it because I thought this was something I was interested in. I thought I'd put it in the drawer. Anyway, again, moving forward, about 2 years ago with our Chinese friends, I was talking to these people and I said, look, this is something that I saw. I just wonder if we could manufacture something like this. And I really upgraded it. And I put these turbo fans inside. I put an array of LED lights in it, and we changed all the mirrors to all these different shapes and sizes. And then we put millimeter notches, and I put arch shapes, and I put midlines. I did all sorts of things on the mirrors. Again, this was all aimed at orthodontics to capture imagery. And then all of a sudden I realized, hang on a minute here, I can create a fog-free environment on this mirror with these incredible mirrors where I can see with incredible detail. And that was initially it was using an SLR camera, but hang on, all of a sudden the cameras in the phones, in the mobile phones, started to become better and better. So I just hooked the two technologies together, and I thought, well, hang on a minute here. We've got something which is mind-blowing. So about 2 years ago, about 18 months ago, we completed the first prototype of what's called the Demystify. That's the name of the product. And it's a fan force. It's a basically turbo version of fans with lights, 5 different mirrors. And this is very useful for doctors, in particular for dentists, to be able to take patients' images using their phones. Now, iPhone 13 Pro Plus, whatever it's called, the imagery from these things, Ron, is like mind blowing. I can see stuff that I'm thinking, wow, it's better than I can actually see if I sit there with a small mirror and I've got fog and saliva. I give some patients, the patients are capable of now taking quality imagery like you wouldn't believe. So I thought to myself, hang on a minute here. Well, if the patients can do that, so if I'm a dentist and I give my patient one of these kits and I say, look, you don't need to come and see me in 6 months. You need to see me in 12 months. But 6 months from now, I want you to put this device in your mouth and take some images. And I'm going to just have a look to see if your gums are okay, if anything's broken, anything's cracked, anything which is heinously obvious. I'm going to look down the back of your front teeth to see if there's any calcified stuff. We can look at the floor of your mouth. And I'm not saying this is definitive and replaces a dentist. That's not the case. But as an interim thing, in this COVID environment, in this time-sensitive environment, all of a sudden the patient can get involved here. And once the patient's involved, they realize what's in their mouth, they're not scared, takes away fear, saves time, saves energy, saves chair time, all sorts of things all of a sudden popped into our head. So I built this kit then around this, and my team thought I was absolutely lost it because all of a sudden I started putting disclosing material in there. That's to check the quality of the gums, cleaning devices, retractors, cotton rolls, everything. So all of a sudden we have got the ability for people who are geographically indisposed in nursing homes, doesn't matter where they are, all of a sudden you give them one of these kits and they've got the internet, they've got the app, and all of a sudden we say, take these images. If you've got a toothache, if you've got this, you got that, blah, blah, your kids like this, the healing of implants, all sorts of possibilities here. I thought, wow, we just need an app now. It's for the patients to be able to have to be HIPAA compliant, which is an important thing from a privacy perspective, but for the patients then to be able to basically upload the images from they've taken themselves, send to the dentist, and there's a chat facility on this app. And you basically look and sort of say, hey, Ron, how are you? Look, today I think I broke my thing. I took a photo of this. What do you think? Now, Ron gets a notification. Ron writes back and said, oh, my God, you've got this, you got that. He then annotates it, puts a circle around it, puts an arrow, sort of saying, this is where the crack is, this is where the nerve is. You've got to come and sort of see me, da-da-da. Or, on the other hand, look, it's nothing that's happened. You might have thought this and da-da-da. We've given them bite paper. We've given them, like, all sorts of possibilities in this kit. So the patient can almost like be very involved. Now, once the patient's got the kit, again, they're educated, they're more interested, they're not so fearful, and the whole game sort of changes. So just by using the tech, by combinations of lots of tech, throw it all together. My daughter and a team, we put a team together of 4 people to build this app. And they're building an app, as you know, is not so easy, but certainly one which is HIPAA compliant, and it's got a lot of where you get a lot of storage for a lot of images and portals for the dentists to be able to look after all their patients. Extremely powerful. So this is something we just haven't released it yet in Australia. We've released it in the US. We presented this thing called The Next Big Thing in Las Vegas at the end of June. Had an incredible approval rate. It was like a Shark Tank thing for dentists, and the reception was just phenomenal. So we've sold already a lot of them. I don't even know if I can make them fast enough. But for capturing for dentists to be able to capture images in the practices, even just use that alone is phenomenal.
So what is the kit? What is a kit consist of? You're talking about the mirrors and the fan.
Yeah, so the basic.
What is a kit?
The basic kit. If I just see if I've got one here. I just happen to have one here, right? Inside this sort of kit, and it's called the open wide kit. Inside here, we've got so a patient basically goes home with his kit. So the only thing, So here is, I really wasn't going to talk about this, but there is the series of mirrors, Ron. I'll just get this out. There's a series of mirrors. I don't know if you can see that.
Yeah, that's okay. You just describe it for our.
And now what's interesting, Ron, is I'll just show you this because I think this is one of the most interesting bits of tech that we've come up with.
Now, this is exactly to our listener why we're encouraging everyone to go on our YouTube channel, because the graphics that are coming in on some of our podcasts are not to be missed.
Well, if you have a look at this, Ron,
Yeah, that's a mirror attached to, wow.
and then if I put this,
That's a dental mouth mirror. Yeah, yeah. Yep.
you got too much light there, but what I'm sort of saying is
That's right.
put that in the mouth and then get your iPhone and
Yep.
take an image, and all of a sudden we've got something which is pretty incredible.
That's the sort of mirror we use in our practice every single day on every single
Yeah,
patient to take high definition
yeah.
photos. And I agree with you. The iPhone, the phones, I mean, the iPhone 13, we don't need to do a commercial. I'm sure there are other phones similarly, but the quality of people's cameras is now another level.
Ron, it really is. And so what we did was we took it a step further, and then we made a nozzle, and the nozzle actually hooked onto the back of this, and this allows the patient then to blow all the saliva away. It's got a light on it, and then
Wow.
this actually acts as
Yeah, which is important.
it drives the saliva away. So all of a sudden, I say
Yep.
to the patient, "I want to be able to dry this." So we built that nozzle. Our industrial designers, we designed this, and this
Yep.
fits in the back like that.
Wow.
And then, of course, we've got all the other sort of things that go with it. We've got cotton rolls, we've got articulating paper, we've got
Yep.
all sorts of bits and retractors and
Fantastic.
stuff. So you give this to one of your patients, Ron, and if they're living in Bathurst or Broken Hill, or they're going away, or you want to monitor their Invisalign treatment, or they've got gum disease, I mean, doesn't really matter what it is.
Fantastic.
You can just through this
Yep.
one kit, you can manage. So
Yes.
that's the full open wide dentistry kit. It's got things for TMD in there. It's got you can measure their mouth opening.
Temporomandibular, that's TMD to the
Yeah,
listener, is
sorry.
temporomandibular joint,
Yeah,
your jaw joints. And the reason, of course, dentists keep blowing air on your teeth is so they can
yeah.
see. If there's saliva on the tooth, you cannot see it.
So that's why this is
So, wow, what an innovation.
yeah. So
Yeah,
that's one
brilliant.
where we're just putting the final touches to the app. We did a trial run. I gave a lecture in Lexington, Kentucky, with one of my good friends, because I do a lot of study clubs over there, like all over the states. And I was in Kentucky recently, which was a lot of fun. And this was where it went down well. So we've just been doing little groups here and there, and getting them into practices now. So we're just rolling it out now. And yeah, this is very exciting. So this is where we see the future of dentistry, that a dentist is going to have a hybridized practice where they're seeing, again, 75% of their revenue is generated, through seeing patients in the chair. And the other, they're interacting with patients in a virtual environment, more from a monitoring perspective than anything. Also, after post-surgery, after this, after that. And for the kids in particular, it takes the fear out for the kids. My little grandson is a master at this. He goes around with his little device of taking images of his schoolmates, probably spreading COVID, but that's another story. But he's out there with his little device, and he thinks it's just a toy. He looks at this thing and thinks, well, everybody's got one of these. And look at my teeth, and I can show you how healthy they are. This is how I brush them, because there's no fear going to the dentist. He knows what the dentist is looking at. So I think
Yep.
this is a very, very, very big game changer. It's taken a lot of work to get to this level. Again, we're just on the edge of releasing it now. We're going to the Greater New York meeting, for a big dental meeting in the end of November. But so far, the shows we've been at, the orthodontic shows, the response to this has been phenomenal. So,
David, it's just been so great to catch up with you and to hear the amazing things that you've been doing since all those years ago. We shared a lift into the university together
we did.
and graduated together. It's fantastic. Listen, I wanted to ask you this, taking a step back from your role as a dentist, as an innovator, as a lecturer, because we're all on a health journey together in this modern world as individuals. I'm interested to know what you think the biggest challenge is for us on that journey, for an individual trying to be healthy. I'm not talking about dentistry here, just generally.
Yeah, that's a good one, Ron. I think there's a couple of things here that, and just based on my experience, is that number one is that I think that to be informed and have access to information and not misinformation, because I hear so much misinformation, and you must hear the same thing. I think that being sort of spread misinformation is very dangerous. So I think the ability for and the sort of the attitude towards an individual to be looking for information for